Why birth weight matters? Low birth weight is one of the leading causes of newborn death and long-term health complications. While it's often linked to premature birth, full-term babies can also be small for their gestational age, meaning factors beyond pregnancy length are at play. Environmental exposures during pregnancy are increasingly recognized as key contributors to fetal development. What is PM2.5? One major concern is PM2.5, fine particulate matter, less than 2.5 micrometers in diameter. These particles are small enough to be inhaled deep into the lungs and enter the bloodstream. PM2.5 is a regulated air pollutant in the United States and comes from sources like traffic, industry, and combustion. How PM2.5 affects pregnancy? Experimental studies show that PM2.5 exposure can trigger placental inflammation, alter DNA methylation, and reduce nutrient transfer from mother to fetus. These changes can slow fetal growth even in full-term pregnancies. The study. To better understand when exposure matters most, researchers analyzed weekly PM2.5 exposure during pregnancy using data from over 16,800 mother-infant pairs across the contiguous United States. The study drew from the ECHO cohort, covering births between 2003 and 2021, and focused on full-term infants. Key findings. Overall, higher PM2.5 exposure was linked to lower birth weight for gestational age, especially during the first 5 weeks of pregnancy. This early vulnerable window was observed only in male infants, suggesting possible biological differences in sensitivity. Regional differences. Negative effects were seen in the Northeast, Midwest, and Southern US, while no harmful association was found in the West. Certain regions also showed specific sensitive windows later in pregnancy, highlighting that location matters. Population impact. Although the effects on individual babies were modest, they are significant at the population level. Even small shifts in average birth weight can increase the number of babies born with low birth weight, especially when combined with other risks. Take-home message. This study shows that when and where air pollution exposure occurs during pregnancy matters. Protecting air quality, especially in early pregnancy, could play a crucial role in supporting healthy fetal growth and long-term child health. This is based on findings published in JAMA Network Open, 2025,